Hey everyone, Dr. Kave here, and I want to start off by introducing the new member of our family. This is Mando, short for little Mandalorian here. Little kitty that we got the other day, thought that he'd make everyone's day here. He'll be joining Karma and Mochi in our posts in the future. I'm Dr. Anthony Kave, and one of the most common misconceptions that patients have before surgery is thinking that their anesthesia is going to last in their body for a long time, or they don't even know how to ask me how long the anesthesia will ask. And that's a really important question because everyone wants to know when they'll be their normal self. The problem is that it doesn't have to do with your normal self or how long the anesthesia lasts. It has to do with how your brain interacts with the anesthesia, which depends on lots of factors that patients don't know to ask about. So this is what you need to know about the different types of anesthesia, whether it's through a breathing tube or through a mask or through the IV. And first and foremost is that the anesthesia effects often outlast how long the anesthesia molecules themselves are floating around your brain. So for example, patients ask me, how long does the anesthesia last? And I'll explain that it might last for anywhere from 20 to 40 minutes, but you might not remember anything for the next hour or next hour and a half. Why is that? Just like how you can have, and I don't want to use a mental health example in a bad way, but you can have a traumatic experience that affects you in the moment, but the memories last for days, months, and years after. Anesthesia is kind of similar. You can have the medication hit your brain, and then the anesthesia goes to other parts of the body as it is eliminated out of your body, but the effects may continue, especially the effects that you care about are the amnesia effects, meaning how long does it knock out your memory formation? Because that's what most patients care about, in addition to how long are they going to be saying something silly, right? Now, just as a reminder, if you haven't been here before, this is live and unscripted in response to your questions that you're asking me live, so please ask away. I appreciate all of your kind comments on little Mando, the new kitty addition to our family. There are two things you need to know: that anesthesia has effects in the brain, that anesthesia is eliminated from the brain, but also has to be eliminated from the rest of the body. So anesthesia in the brain is the easy one because we know that most anesthetics are fat soluble, just like marijuana is fat soluble, just like how nearly any drug, Celexa, Cymbalta, Zoloft, etc., are fat soluble because they have to reach the fatty tissues of the brain where your neurons live. So they will go into your bloodstream either through direct injection or because you will inhale them, and they'll be directly picked up through your lungs, just like how things like mold are picked up through your lungs often, just like how paint solvents or any other number of medications that you sniff. I mean, heck, even marijuana, when you inhale it, it is being absorbed into your bloodstream through your lungs, and then it goes to the part of your body that soaks it up the fastest. That's often the brain, depending on the molecule that is being placed into your bloodstream and the affinity that that molecule has for the receptors, in addition to how fat soluble it is, meaning fat soluble means it wants to go towards fatty tissues. So if you're thinking, well, do people with a lot of fat in their body soak up more anesthetic? You tell me, and I'll give you a shout out if you're correct, because you are, you deserve a shout out. Hey, and I got to give a shout out here to skate surfer snowboarder. Yes, his name is Mando, short for Mandalorian, the little kitty. And Heidi, I appreciate letting everyone know that if they want to keep up with more questions, they can always join the Supercast, where in addition to what we do here, you can access our private live streams to ask more personalized questions. And you also support me doing this for you more often. Arlene August says, yes, the more body weight you have, the more adipose tissue or fat cells in your body, the more anesthetic it soaks up. So you might need a higher dose depending on what anesthetic agent is used. That is why some anesthesia agents are dosed with your ideal body weight, meaning for your height, versus your actual body weight, which is your actual body weight. So depending on how old you are, depending on what the surgery is, depending on how much anesthesia you've gotten because of the length of the surgery. That determines the effects of anesthesia in your brain. A big distinction is whether midazolam is used, that potent benzodiazepine class medication. We call it Versed here in the United States. That medication will wipe your memories for hours to come, even after most of the medications have already left your central nervous system, which is where your brain is stored. That's the compartment of your body that we care about with regards to memory formation and how disinhibited you are, meaning how silly you are when you speak, right? Another interaction that most patients don't even think about asking is your mental health state. So if you are very depressed, if you're very anxious, if you've had past traumatic experiences, especially if you're taking medications for them, that influences how your brain will interact with the anesthesia medications. That sometimes increases how long it lasts, the effects, and sometimes it decreases. But that takes us to step 2, which is how do they actually leave your brain? Because eventually the effects will wear off when the medication leaves your brain. And those same medications I mentioned sometimes influence how long it takes for anesthetics to leave your brain for you to begin to wake up. There are some medications that increase metabolism. Do you know any of those medications? Let me know below a common food or a common medication that increases drug metabolism, and I'll give you a shout out. There are 2 phases of elimination for you chemistry nerds. There's alpha and beta elimination. So Maureen Sullivan gets a shout out for grapefruit being a metabolizer of the CYP enzymes in the liver that can influence drug metabolism. And I'm waiting for a medication. Tina J says caffeine. Caffeine may have a similar effect. We use it mostly in children and pediatrics who aren't breathing. So I don't use it in adults because it's not as well consistent of an effect. Benadryl, no. Gabapentin, no. Narcan will antagonize opioids. So Storm and Norman, you're kind of right on that one. So is Yakid Nefesh, bupropion, naltrexone. Yeah. All right. I had to go back to alpha and beta elimination because when patients ask if they want the technical answer for how long the anesthesia is in their body, because they know not to sell their house or their retirement portfolio, break up with someone, right, for the rest of the day, because you're disinhibited from the anesthesia, they want to know how long it lasts in the body. In addition to how long the effects in the brain last, which the first thing we talked about was, got to recognize that there's alpha and beta elimination and gamma elimination. Very fancy words for very basic concepts. Alpha elimination is how long does it take for the medication, often propofol, does it take for that to go out of your brain into the rest of your body, whether it's fat cells, often lean body mass, meaning muscle. So patients that are really muscular, think of like Arnold Schwarzenegger types, are going to have propofol go from the fatty tissues in their brain, where they act first and fastest when they fall asleep. Linda was kind enough to share videos of her going to sleep for everyone to see. And you can see just how fast the propofol kicks in because it hits the brain very quickly. But it also quickly leaves the brain and dissipates into other compartments in the body, like your lean body mass, your muscles. That's called alpha elimination. Alpha elimination, leaving the target site in the central nervous system and going into your muscles. Next is beta elimination. That is how long it actually takes for the medications to metabolize out of your body. So you get the propofol, for example, it goes into your brain, goes into your lean body mass, into your muscles or your fat, but it eventually has to go away. It gets metabolized by the liver and kidney, so the propofol gets munched and crunched and taken apart by your liver and kidney, and then eventually you pee it out and you actually defecate it out in your stool. That's called beta elimination. And together, when you combine the alpha and beta elimination, they call that the gamma elimination. How long does it take ultimately for that molecule to leave your brain and leave your body? So when we ask you not to operate heavy machinery or make any big purchases on the day of surgery, it's because that half-life is often anywhere from 2 to 8 or maybe 12 hours. And you want the half-life to pass. So For example, if we're saying an 8-hour half-life, you want 5 half-lives, maybe 8 times 5, or 40 hours to pass to make sure that enough of the anesthesia has literally been cut in half in your body a couple of times, 4 times, if we say 4 half-lives, so that at least the molecules have left your body physically. But the question is still there, what about the effects on the brain? The big question is, what effects in the brain outlast the actual molecules of anesthesia coming out of your body? It's like I said, your propofol, you will poop it out. Your ketamine, you will pee it out to an extent. The anesthetic agents that you inhale, you will breathe them out. But why do depression, REM sleep disruption, or nightmares, why does pain sometimes outlast the effects of the anesthesia itself? Well, pain will be there for the surgery, but sensitization to pain can be a result of how your body interacted with the anesthesia, or the depression, how your body interacted with the anesthesia. And this is where ketamine is perhaps one of the most fascinating medications to think about, because ketamine also lasts for a short period of time, but the effects can outlast. And that is because of this neuroplasticity effect. Ketamine, you eliminate it from your body. You can do the pathways. You'll see that the half-life is quite short. Yet the effects that patients have, for example, in my clinic or any ketamine infusion clinic, or from other psychedelics, psilocybin, LSD, MDMA, long after that chemical has left your body, there is an effect on your mood. There are long-lasting changes from what we call this neuroplasticity effect. Anesthesia is similar, both the positive effects and the negative effects. And this is what I want you to realize, because you have an influence and an impact on how that anesthesia interacts with your brain. When patients come in afraid, unheard, not having a reason or a purpose for why they're having the surgery, not feeling like they've been blown off by their doctors, that will hijack their sense of vulnerability and set them up potentially for that neuroplasticity to leave a bad effect in their brain, leading to PTSD after. How different is that than the patient that feels empowered, has advocated for themselves, has a surgeon who has listened, an anesthesiologist who is caring, etc. When a patient falls asleep with that sense of tender loving care, if you will, that TLC, that can transform that neuroplastic effect from one that can lead to fear responses, hypervigilance, maybe depression, worse pain from the surgery. There's something that can be healing in the long term. And that's what I hope that you can take away. It's not about when you can drive your car again or go gambling or sell your retirement portfolio. It's about what effects will last in your brain after anesthesia, even after those molecules have been exhaled out or eliminated otherwise. So Linda, thank you so much for the kind super thanks. Alexis, same. You're right. There are 3 fur babies now and a cougar's cub. Very kind of you all. I apologize if the audio cut in and out, but I hope that you were able to get some of your questions answered. Do please hit a like button. Support me doing this for you more often. You can always learn more about what I do at my clinic, Claris Health in San Francisco, where I use ketamine and NAD and other infusions to help patients with this neuroplastic effect. And of course, the Supercast, where you can sign up for our private live streams to ask more of your questions. But let's answer a couple more of your questions before we go. Teresa, I didn't see your question. Oh, I see it now. I woke up in a horrid state, says Teresa, despite having a good surgeon and a good anesthesiologist. Well, Teresa, I'm so sorry that you had that experience, but recognize that those are part of the experience. But there's also the type of surgery. How much pain did you wake up in? Were there surgical complications, perhaps? Anesthetic complications? What was your support like before you went into the operating room and immediately thereafter? What were your vital signs like? What medications were you given? What I want you to take away is that when you've optimized all of those other variables, sometimes the make it or break it is going to be how comfortable you feel with your doctors. But those other health variables must be optimized first. Very good question. I hope that you had support after you woke up from surgery to ultimately heal and have a more positive experience. Why did I puke and have nausea so bad? Teresa, that's often from the anesthesia medications, from the pain of surgery, or from the pain medications after surgery. Perhaps, how long will it take to leave breast milk? Berica, very good question. Pumping and dumping after anesthesia. Have you ever heard of anyone who's been pregnant or who has been breastfeeding have anesthesia or surgery? Let me know. I'm very curious. I'll tell you that the majority of medications, you always want to confirm with your anesthesiologist what medications you get. But the vast majority of medications that we give, especially IV or inhalational, are the same medications we give infants undergoing surgery. And that's a positive sign, because if the baby can get those medications and be okay, then the breastfeeding mother typically can also continue to breastfeed. So pump and dump is usually not required. One exception is meperidine or Demerol. We do not give that to breastfeeding mothers. I, out of abundance of caution, don't discourage women from pumping and dumping for 12 hours or 24 hours, but you always want to discuss with your anesthesiologist. Fortunately, the preponderance of evidence shows that propofol, gas are not a problem. The risks of not breastfeeding outweigh the risks of potential minor amounts of anesthesia in the breast milk. But you always want to speak with your doctor. Exotic Water says, had emergency surgery last week, was rushed around, ignored prior. Since the surgery, I have had the most severe bout of feeling so depressed. No complications. I'm so traumatized. Is this normal? Well, Exotic Water, I'm so sorry that you had that experience. It could be from any number of reasons, pre-existing or from the surgery itself, maybe depending on where the surgery was. But that sense of dread, doom, despair, confusion, lack of confidence before you fall asleep and while you're under anesthesia likely could impact how we feel, which is why it's so important that you find professional help. And that if awareness under anesthesia did occur, you work with a specialist who knows how to process and help you discover maybe there was awareness under anesthesia that is causing these depressed feelings, because awareness under anesthesia is more common under emergency surgeries. And people are asking me about mushrooms. What can I tell you about mushrooms? Alexis is correct. You can ask for music. Very good question. And pineapple water. A syndrome, depersonalization or derealization. The latter, pineapple water. I need to look that up specifically, because I don't believe that I am. I'm not as knowledgeable about that as I want to be, and I'm going to be perfectly honest with you. So we can move on, but disassociation. I hope that you understood what I shared. Have I ever had a patient who has bipolar disorder who's had mania after surgery? Cat G, I have not. Has it been described? I believe so. The risk is probably quite low when we continue mood stabilizers, whether it's Lamictal or lithium, and when we are careful to not allow pain to be untreated, and we don't lose the social connection that that patient has pre-surgery, after surgery. Why do I wake up angry? Oh, well, Tammy, is it from the bipolar? Unlikely, though I cannot exclude that, of course, because many patients will wake up angry with emergence delirium, even who do not have bipolar. Very good questions. How often do patients wake up in pain after surgery? Well, eating healthy on a budget, Canada. Good question. It depends on the type of surgery. Very good question, but the goal is to not let patients wake up in pain. Oftentimes, patients won't remember how they wake up because of the ongoing amnesia. So even if a patient wakes up in pain, they often don't remember. Last question, Gina. How long does anesthesia stay in the body after surgery? Because some hairdresser said it makes hair look bad and stays in the body for a year. It doesn't last a year. Very good question. But if gray hairs temporarily come up from the surge in epinephrine, from the stress response to surgery or anesthesia, well, you will see that in your hair until you cut it, because the hair is like looking back in time. And I personally have gray hairs turn black after that stressful scenario has been overcome. So even though the anesthesia does not last in your body for a year, your hair is obviously a time-keeping, time-traveling way of looking at the past in your body. Very good question. Until next time, everybody.